What is compartment syndrome? A patient information video. Have you broken a bone?
Ouch!
Are you in a plaster cast? Here are some important things you need to know about your plaster cast and health before you leave the hospital. Whilst having your plaster cast on, if you start to experience any severe pain that continues to worsen, pins and needles or decreased feeling in the affected limb, your limb feels hard like wood, or your muscles begin to feel more weak. These are signs that you may be suffering from compartment syndrome, which is an orthopedic emergency and needs urgent attention. Go to your nearest doctor or healthcare facility as soon as possible and inform them of your symptoms. I am sure you are asking yourself, what is compartment syndrome and how does it come about? Think of a bathtub. It has a tap which lets water into the bath and a drain which takes the water away. Normally, if there's no blockage, the water will flow easily from the tap into the bath and out the drain pipes. But if something gets stuck in the drain pipe, then the water cannot flow out of the bath easily. Therefore, the water will flow out of the tap into the bath but cannot flow out of the drain. This will cause the water to build up in the bath. The bath is initially big enough to accommodate the increasing amount of water, but as there gets more and more water, the bath may start to crack as there's too much pressure from the water. Eventually, the water will reach the top of the bath and the bath cannot hold any more. This is what happens in compartment syndrome. Let's say the water is like the blood in your vessels, the bath is like your limb, which holds the blood, the tap is like the artery that brings blood into your limb, the drain is like the veins that take blood away from your limb back to your heart, and the rubber duck stuck in the drain is like the plaster cast on your limb if it is put on too tight. The cracks act as warning signs, which indicate that the bath cannot fill up anymore and is under too much pressure. The cracks are like the symptoms mentioned earlier, indicating that your limb is at risk, as no more blood carrying fresh oxygen can reach your limb, therefore the cells may die. Now that you know what to look out for, we wish you well on your road to recovery. Thank you, Bayadanki, Inkosi kakhulu.